Today we're talking about a subject that is near and not so dear to my heart. It's called Rhytides. And what does Rhytides mean, Jessica?
I don't know.
Jessica, you don't know?
I don't know.
Jessica, you worked here for I don't know how many years. It's the medical term for wrinkles.
Oh.
And I brought Jessica in because she's wrinkle-free. And it doesn't last for long, Jessica. Do you have any anxiety about developing wrinkles in your life?
Yes.
Like a little bit or a lot?
A lot. But I have good genes. My mom looks great.
Okay, so I have good news and I have bad news. Your skin is perfection right now. The bad news is that you're more likely to develop wrinkles than many people out there. Do you know why that is?
Because of my light skin.
Because of your light skin, exactly. So, but the good news is Jessica is doing a great thing in preventing wrinkles. And what is that, Jessica? What are you doing?
Wearing sunscreen.
You're wearing sunscreen and you have no tan whatsoever.
No, I don't tan.
So, have you ever tanned in your life?
A little.
Have you had sunburns?
Yes.
All right, having sunburns actually increases your risk of developing wrinkles. And, fortunately for darker skinned people, they have less likely chance of developing severe wrinkles like lighter skinned people. Now, some of the other factors that influence wrinkles or wrinkle production include smoking and genetics and also sun exposure. So we want to make sure that young people work very, very diligently to avoid the sun. Now, people start noticing wrinkles when they're about, you're usually late 20s, and they really start to progress very rapidly. Once you get into your 30s and 40s, you'll get more and more obsessed with this. Now, great news is here at Contour Dermatology, we have a lot of things that help to fight off wrinkles. And Jessica, give me one example of something we have to fight off wrinkles.
Botox.
Botox, great. And those are for dynamic wrinkles. That means wrinkles that are caused by facial expression. For example, give me some areas.
For wrinkle expressions?
Yeah.
Around my eyes,
Do you have
my
any wrinkles?
pubella, my forehead.
Oh my
No,
God,
I
Jessica,
have Botox.
you look so beautiful. You're so lucky. You have Botox? Oh, okay. So there we go. So, for areas that are caused by facial movement, that would be, as Jessica said, crow's feet, glabella, bunny lines. Lipstick lines can actually be used, neck lines. What am I forgetting? Forehead? Is there any area I'm forgetting? Yeah, for wrinkles. No? Okay.
Yeah.
The other thing is, one thing that I always really encourage people to use is Retin-A. And you want to get started with that very early on. And are you using Retin-A? Why don't you use Retin-A?
Why?
Yes,
Because I'm really a bad patient.
Okay.
I'm not compliant.
Well, you're really good because you're wearing sunscreen. But,
I do wear my sunscreen.
The one thing you want to add to your regimen is Retin-A. Retin-A is terrific because it does three things for our skin. First of all, it stimulates collagen production, and we're talking about wrinkles. So if you have healthy collagen, it means less fine lines and wrinkles. The other thing is it evens out your pigmentation so you can have a beautiful complexion like Jessica here. You see there's not one blemish on her entire face, and by that I mean a brown spot. And then the third thing it does is it keeps your skin cycling, and so the skin cells slough off faster. Now, if you look at Jessica, her face is perfection. And why? Because she has that dewy, youthful glow about her skin. And so by using Retin-A, we can do that. Now, some other things that we're really excited about at Contour Dermatology are fillers. And we actually have a new filler. What's the name of that new filler, Jessica?
Bobella.
Bobella. And why is this one so great? Do you know?
It's great for the lips.
It's great for the lips. And what else makes it special?
It lasts a year.
It lasts for a full year. So a lot of people complain they want something that lasts forever. Well, I like a filler that doesn't last forever because if you see people who have silicone, sometimes it looks their faces look distorted and very weird. It's kind of shocking sometimes when you see people who have silicone because it actually swells over time. The great thing about this product is you have longevity, but you can always melt it if you don't like the way it looks. So that adds to the family of other fillers in the Jupiter family, which includes Voluma. And what's great about Voluma?
Voluma lasts 2 years.
It lasts 2 years, and it was really the first hyaluronic acid that was FDA approved for the cheek area. So you can we can lift up the cheeks, which is actually one of the big problems with the aging process. So fillers we can basically use anywhere. Patients love fillers. We have a huge filler practice here. And then what's one of the other things that we have that's so special? We have one right here, in fact.
A laser.
We have lasers and devices. So we have lots of lasers and devices, and these will actually, we have everything from non-invasive, where we have no down, to more aggressive lasers where you have a little bit of downtime. But these actually are really terrific for stimulating collagen, which means eliminating rhytids or wrinkles. And what else can we do here? We have
Products.
We have products. We have great products. We use our GB pairs, which includes growth factors, B is bleaching agents to even out pigmentation. P,
Peptides.
peptides stimulate collagen. E is exfoliants, which are scientifically proven to help eliminate fine lines and wrinkles. What's your favorite one of the exfoliants?
Exfoliants, Baha.
Baha, alpha hydroxy, beta hydroxy, great stuff. I love it.
Antioxidants.
Antioxidants and retinoids.
And sunscreen.
And sunscreens. So we have all those products. And then finally, we do some minor surgical procedures where we actually cut out the wrinkles. So those are exciting too. Anything else you want to say about wrinkles?
No, just to avoid them.
I spend my life trying to eliminate mine. I have little time left over for anything except trying to eliminate wrinkles in my life. So thank you guys for tuning in. And call us at Contour Dermatology if you have any questions or would like a consultation.
Yep.
And Jessica will take your call, right, Jessica?
I will.
Okay. Thank you guys.